and very empathetic as physicians when we are dealing with patients who have been recently diagnosed with cancer. And the other aspect to her thing, and I was telling you from my experience, is that when you are the physician and you've seen a patient for so many years, it's very difficult to give that patient that diagnosis, because you now have to separate from being the friend, because many times they become your friend, and being the doctor who has to give bad news. I mean, many times I've been caught in my bathroom in tears, trying to calm myself down, because I then have to go outside and give this diagnosis, because I know it's not only going to affect the patient, it's going to affect the family members who are also my patients. I have to make arrangements. They may not have the money. Maybe I know for a fact that some of the facilities are not in place, and I may have to tell them, listen, we can only do this much in St. Lucia, and you may have to go. In her case, she has to go for a PET scan. Not everybody, has medical insurance. And that's the other thing that is critical. I urge every young person, before you go and get your life insurance to get your mortgage, before you go buy your first car, get yourself adequate medical insurance. And this is not an advertisement for Obamacare. This is extremely critical for your future. Get adequate health coverage. Many companies offer it to their employees, and the employees do not even take advantage of it. They think it's money down the drain. But let me tell you, one dose of chemotherapy can wipe you out if you don't have the monies in place.
Well, I know we don't like to talk figures a lot when we're dealing with these things, but you know, the doctor gave some guidelines, and some people were thinking, well, maybe it's about $1,000, you know, per. It's not $1,000 per treatment. Depending on what you have, it can be threefold. It could be threefold. You know, so you have to be very, very careful. There are ways to. I wouldn't say there are ways to. If people say a lot, we have to think of our lifestyle. You know, if we look at our lifestyle earlier on in our life, then chances are, if we do get a disease, because we are so conscious, we will go to our doctors sooner rather than later. And of course, when we're dealing with cancer, it's when we leave things and when they're in the advanced state, then of course treatment is going to be worse than if you had got it right at the beginning. But before we have to say goodbye to you, Stevie, I just wanted to ask, is there anything else, any message, anything that you would like to tell our viewers?
Well, just picking up on what Dr. Bovary just said about getting health insurance, because that's the reason why I'm able to go to Miami and get a PET scan and have excellent treatment. I did have excellent treatment. I'm still having excellent treatment in St. Lucia, and that is because I've got health insurance.
And also, I think one of the most important things you said as well was the fact that you had your care here in St. Lucia.
Yes.
Because all too many times I have heard people complain about healthcare in St. Lucia, and some of the physicians we have. Well, you get that everywhere in the world, I think.
Yes.
Yes.
You know, it doesn't mean that
They
if
think
I go
it's
to
because it's
England,
St.
it's going to be
Lucia.
better.
Yeah.
You know, to me, it depends on the person who's dealing with you, how they deal with you.
And also, our people have to learn to ask the doctors questions. Don't just think that the doctor knows it all. You've been diagnosed with cancer. You get your people around you, you try to do a little research, try and find out about questions you can ask about your condition. You want to know, you need to know. A lot of people we talk to, you know, what stage is your cancer, what kind of cancer you have? I don't know, I don't know nothing. You need to ask questions. The doctor, I'm sure, will answer and, you know, advise you.
But I think as well, you may find that you may have been told your stage, but you've told so many things in that one visit that you cannot possibly absorb it all. And the other thing in her case is that she had her support system in place. And the beauty of having your treatment done in St. Lucia is that you have the support system there. You know, you have your family. It makes a big difference.
When the doctor told me I had cancer, he used some big words, and it went over my head, and all I can think about was trying to find my phone to try and call somebody. And he was talking, and I thought, I feel faint. I've shut off. I just shut off. I couldn't hear what he was saying.
That's a very, very common reaction.
I would expect better of a doctor, to be honest.
No, but I don't think it's the doc. That's what I'm trying to
No,
say.
it's
The
good.
doctor is doing what he is, what they are, what
Yeah,
we are trained to do.
But you're also trained to have bedside manner. So the
Not
bedside
necessarily.
manner.
We are trained to have the
The
knowledge.
bedside manner, yeah, well, but I'm sure, isn't there any training that doctors get to say, well, you know what, when you need to tell a patient that they have, you know, whatever
No,
it is,
his
this is
bedside
the
manner
way.
was-
I
He was
think,
very
but what I
good.
think is that that
Very
doctor
good.
is trying to tell
He was
everything.
trying to dissect and tell me, because
Right.
he was trying to tell me before on my previous visit.
Right, okay.
But he was
Prepare
going to prepare me. But now the results in, he's trying to tell me, very nice, that's how he talks, dissect everything, but you just shut off. I was like, what did you say? What did you just say? I
You
mean,
heard cancer and that
I
was
heard
it?
cancer, and I said, what did you
Yes,
say? What did you
yes.
just say? And he told me again. I said, what did you say?
And nothing else
You
will
just,
go through.
it just doesn't, you just a block. And I'm fiddling in my bag, and both my phones, I've got 2 phones in my bag, and both of them got low bats. I'm like, oh my God, I'm going to faint.
You know, before you go, you said something to me before the show started, and I'd like for you to say it again, to share it with the other viewers, because I think in its own way it's inspiring. You said something about meeting Dorothy, and, you know, of course, your prayer and so on, and you got cancer, and you sometimes you think there was a reason why you got it. Can you remember saying that to me?
Yes, you know, while I was, you know, really low, even though I had this cancer, I felt very blessed. I felt very blessed because of people like Dorothy coming to talk to me, people praying for you, that just as the whole support, I felt really blessed, and I could not say, why me? Those words just couldn't come to my lips at all, and why should I have? I couldn't say that. And I said, why not me? Why not me? And through Dorothy's work, I just couldn't wait to join the Faces of Cancer group and give back, because I believe I received so much love, so much support. You know, there's always somebody there.
Well, Stevie, thank you so much for sharing your story with us. I think
Thank
you look
you.
amazingly well, and you can
Thank
just
you.
feel.
You can feel
just
it.
feel
She's
she's
oozing
vibrant. Yeah,
serenity.
she is. She really is. And all the best with your future
Thank you.
endeavors. And thank you for supporting, because there are some selfish people in this world. They get the support, and then when they're okay, off they
No,
go. You don't
it's
see them again.
It's important to give back.
Yes.
It is very important to give back, and I don't think, if it wasn't for cancer, I don't think I'd be working so hard in Faces of Cancer. You know, make time to go and see people, sit with them, go to doctor's visits with them, you know, really try to educate yourself so you can educate others. It's very important to give back.
Well, I will thank you on their behalf.
Thank you.
Thank you so much for being here
Thank you,
tonight.
Doctor.
Well, when we come back, we're going to have Dorothy Phillip, who is the president of Faces of Cancer. She'll be here with us to tell us more about Faces of Cancer, and also some other things she'd like to share with us. So make sure you remain on DBS, and we'll see you soon.